Minutes from our last meeting in your packet. Are there any additions or corrections to those minutes? All right, hearing none, the minutes will stand as presented. All right, what are we going to skip to first, Jamie? We're going to turn it over to you.
Hi everyone. The thing that we would need to skip to is the brief presentation that I was going to share on maximizing benefits and supporting clients through SNAP changes in SOAR. So I can just pivot to that really quickly.
Sure, there's a change or two.
Yeah, and let me make sure that my slides are, I gotta go through a couple. There we go.
Yeah.
I believe it's recording. Yeah, I see the little
should be
thing.
good.
It is.
So we kind of just wanted to highlight why agencies should be aware of SNAP benefit changes, just because a recent couple of updates have been introduced and it can affect the individuals and families that we serve and also affect the benefit amounts they get and different work requirements that they have to go by. So we just wanted to highlight that, bring up some of encourage agencies to help clients increase their income and then also remind folks of resources and then kind of offer support and leave space for any questions or anything. So a couple things just briefly, and there are a lot of resources on the state's website that and links that we plan to send out after this meeting, kind of all compiled into one. So if people have more questions or if they want to know more of the nitty-gritty, you'll be able to see that. But this is just kind of a basic overview, talking about general work requirements that are part of the SNAP eligibility. So that means that some individuals have to meet certain work-related rules in order to receive SNAP benefits. And if someone is required to follow these work rules and they don't comply, they can lose their SNAP benefits entirely. So if they meet this work requirement, it isn't optional. It directly impacts whether they can receive assistance. So those that have not changed, the work requirements still apply to individuals ages 16 through 59 who are able to work. And in order to stay eligible, individuals must register for work when they receive a notice from DHS, participate in SNAP employment and training if that's been assigned, accept a suitable job if one is offered, and not voluntarily quit a job or reduce their hours without good cause. So those things have not changed. Couple things that have changed. One is that under new federal SNAP rules, able-bodied adults without dependents can receive SNAP for 3 months, within the 36-month period, unless they meet the SNAP work requirement. So to keep receiving SNAP beyond those 3 months, essentially they must do one of the following that's listed below. So for at least 20 hours a week. So they must work 20 hours a week. They either have to volunteer or be in that training program, or do community service or a combination of those activities. And Illinois had a state waiver for those rules, but that waiver ended on the 31st. So that means that these work requirements and time limits will begin applying again in Illinois. So that's why it's kind of important for clients to understand these changes and why we're bringing it up today. Briefly, just a couple things, and sorry if the pictures are small. Just kind of talking briefly about who's exempt from the time-limited SNAP work requirements. So the first group, DHS already knows that. So essentially this means in their system, they're aware that someone is within this category. And so folks usually don't have to do much, and they would not be subject to the work requirement, and that time limit issue wouldn't apply to them. This section is for those who are exempt, but DHS might not automatically know this. So it's for those who are caretakers for somebody, someone that has applied for employment benefits, if someone is pregnant. I can't read the other one. And so this is something where a person can do a self-attestation, meaning they have to report their situation to DHS. So that's something to keep in mind where DHS might not know this, and so someone will have to provide that information to them. And then third, who else is also exempt? This must be submitted by third-party documentation, so folks have to, or DHS must know this, but if someone was engaged in a domestic violence services, if they're engaging in homeless services, and then any of the categories in part 2, if there's any questions about it. So if in part 2 someone self-attests and DHS has questions, then they will ask for third-party documentation to verify that further. So, sorry, I'm switching everything, or I'm on 2 different keyboards. With SNAP benefits changing and with those brief categories changing, and just with all of the information being pushed out and the timelines and the deadlines and everything, we just wanted to highlight that, and then also make sure households are aware and that they're pushing towards having or securing additional income to make sure that they still have access to food throughout the month and that they're able to build long-term financial stability. So couple things we wanted to highlight. One is the SOAR, if you're a SOAR certified provider or just utilizing that as a program. This program helps people experiencing or at risk of homelessness get disability benefits, also helping improve their housing stability, healthcare access, and any reliance on crisis services. And then the other resource that is helpful is workforce programs. So those programs can help provide job training. There's different certificates. They have interview prep. They might even have work clothing for folks. And I feel like these 2 resources are very underutilized in our community, but they are resources that are available to folks. And so SHPA, and I don't know if Olivia's on right now, but SHPA is a great resource for SOAR. They do trainings. They have a database essentially where people can track their efforts, and they've really streamlined the process to where the providers feel comfortable and know where to start when they engage with somebody who is in need of SSI or SSDI. And then
Hey, Jamie, I'm here.
Hey, Olivia, thanks for joining. Appreciate it. We'll touch base, or after this presentation, we'll have you speak on SHPA's SOAR efforts, if that's okay. And then also for locally, the Land of Lincoln Workforce Alliance, they presented, I believe, last year, but they just have a plethora of resources. They know when job fairs are. They can help people with resumes, and they're right within our area. So just wanted to highlight those 2 resources, and that way, if folks are engaging with clients and they don't know where to start, those would be 2 great starting points for assisting them. So again, why did I talk about this? Why am I sharing SNAP benefits? Why am I sharing increasing income? Really, we just want to ensure that clients are able to maintain their housing and reduce the likelihood of returning to homelessness. Stable income makes it easier for clients to have means if there's any unexpected expenses, or also just to ensure that if their SNAP benefits had decreased, they still have access to food. They're able to have transportation places, healthcare, childcare. It also shows or it helps them build independence and dignity, long-term self-sufficiency. And lastly, increasing income supports HUD performance measures for long-term stability. I'm just throwing that in there, but that's one area where it's important, and one area that HUD looks at each year as a community and as a system to see how well we are helping folks sustain their housing and for how long. And so again, just wanted to highlight a couple of those things, highlight the necessity for helping clients increase their income, and then offer those resources. And then if anybody has questions further or needs support in any way, offer me as a person to go to, and I can help you guys navigate certain resources. So that was it briefly. Any questions before we go back on the agenda?
I do have a question. I've been utilizing a form that says SNAP Work Rules Exemption Form, and it's the one for self-attestment. And um, I've I've used it specifically with clients that I know have a mental or physical condition that is preventing them from securing work. And whether they've got Social Security with it or not, I'm having them check that. And then also there's a secondary one that says experiencing chronic homelessness. My question is, if they're in a rapid rehousing program, which they entered because they were experiencing homelessness, is that a valid thing to check off? Can we say, yeah, they're experiencing chronic homelessness, they're currently in rapid rehousing program like they wouldn't? Is that a right way to think of it?
That's a good question.
Yeah, we may,
Uh,
we may have to really lean in because DHS is gonna be the decision makers here, and I know they're kind of navigating this too, but that homeless services component, that would be the
Yeah.
thing, but I think we really need to work on, and we've had some conversations with DHS about even some efforts to embed some staff, in certain organizations to kind of work on this process, and we're hopeful that we might have some partnerships to announce there, but in the meantime, what we'll do is work on getting the right email address to ask, these types of questions and get that feedback right from DHS. And we'll include that in the follow-up email for this meeting. But it's a great question, and I'm super excited to see that you're already doing everything you can to try to help
Yeah.
people navigate these changes.
That'd be great. I have yet to see any third-party paperwork. If there was third-party paperwork where I could say, yeah, they're engaging in this version of a homeless service. Yeah, I think that'd be great.
That would be a great question for us to ask them too, is like if that gets initiated by them, or if we can go ahead and have access to that paperwork and be working on it for the folks that we're actively working with. So
Right.
great stuff, Bonnie.
I'm taking notes, Bonnie. We'll figure it out.
Appreciate it.
Yeah.
Any other questions? Okay,
Olivia, would
Jane.
you-
Oh, someone?
Sorry, Val. Olivia, would you want to briefly just speak on SHPA and SOAR and resources
Yep.
and kind of plug it real quick?
Yeah, can everyone hear me?
Yes.
Okay, I'm fighting a cold, so I do apologize. But hello, everyone. My name's Olivia. I'm the new SOAR coordinator at SHPA, and there we kind of provide services where we just get trainings for you guys to kind of help streamline the SOAR process. And then we also act as your communication barrier. So if you're having problems with the Social Security offices and you need help, you can come to me and I can kind of figure out what's going on. And then I also provide help for caseworkers when they're having trouble with an applicant. I also talk through it with them, help them with their Social Security applications. And we do that using the SOAR model, which is a process where we complete a FAST report. And in that FAST report, we basically give an overview of what the client's homeless status is. And we also communicate how their disability is affecting their ability to work and how they really do need their Social Security benefits. So instead of just turning in a packet, we're giving them an overview of the applicant so they know exactly what's going on. And then we also add in all of the medical records so they don't have to go looking for them in a sense. And we do have training. So if that's something that you guys are interested in, I will put it in the chat for you. But that is a good place to start. We do also have webinars where we just help people understand Social Security benefits and how they can help their clients in other ways if they aren't able to do the SOAR process or they don't have the time necessarily to help people. We do have an understanding webinar as well for that. And I'll put that in the chat for you guys.
Thank you. Thank you, Olivia.
A couple quick pieces of context there too. SOAR historically was a program supported and in some ways technical assistance was funded by SAMHSA and the federal government. So this was a part of, unfortunately, some of the cuts that the federal government has made. The SOAR Technical Assistance Center went away last September. And so just one thing to note there, thankfully, with SHPA and the state of Illinois supporting this initiative, we have access to folks like Olivia who are working throughout the state to support communities like ours and building SOAR capacity. We have access to trainings. So I know we've been pushing out trainings on SOAR, and some of those are great. If you have no idea what SOAR is and you want to be able to help people effectively navigating getting access to disability benefits that they're eligible for, you have to take the training. You need to do it. If you did it a long time ago, you need to do it again. But one of the things I would note there is that the person that that SHPA is working with to do those trainings was the regional technical assistance director for SOAR and SAMHSA. She's wonderful. She's, potentially one of the most knowledgeable people in the entire country on SOAR and what works and what doesn't work. So part of that is just to say, as folks who do this work in the state of Illinois, we're really fortunate because of this partnership with SHPA and the support from the state. And it's really critical that our organization take advantage of that. We know that historically, one of the biggest difficulties with helping people through the SOAR process is that it's time intense, and there's not grant funding to say, okay, well, every organization gets a SOAR case manager and that's their sole focus, right? Your case managers are already running thin and they're also trying to work through this intense process. So we know that's part of the challenge. One of the things that Jamie and I had the chance to meet with Olivia earlier this month, and one of the things we're looking at creating is a bi-monthly support group for all people who are SOAR trained in the Continuum. Where we'll come together and Olivia's agreed to kind of join us for those as she's able and, answer questions and, give an opportunity for us to say, okay, we're working with this person, we're stuck at this step, what do we do next? Just to make sure that we're networking everybody in the community who's SOAR trained. And, this makes sense for all kinds of reasons, right? I mean, there are people in our community who meet every eligible, disability income exists to serve some of the folks that we serve. And so for there to be barriers that stop the people we're serving from getting to it, it's another indicator of just broken systems. And so it's critical just to support the people we're supporting. Secondly, as Jamie mentioned, I'll hit on this again when I talk about HUD, but historically, one of the biggest places where our community is not competitive in federal funding processes is that we're not showing great signs of helping people get connected to disability income if they're eligible. Our data doesn't show great signs of helping people increase their income. We're not doing that, or at least capturing it in our data at the same level that other communities are. So it's a sign of a place in our community where we really need to kind of dig in and support each other and figure out how to help people get access to these income, whether it's employment or otherwise, and then also to track that in our data. So just wanted to throw that quick piece of context out there. We're really, really lucky. And then I see that Eileen from SHPA has her hand up, so I'll shut up now.
No, not at all. I just wanted to point out, I'm putting in the group chat just our website address so that you can check out the calendar that we have for SOAR. Olivia, we're just really lucky to have Olivia on our team, so that's a great thing. And then we have our SOAR convening coming up on April 28th in Springfield. That is not for, that is more for the person who's monitoring your organization for the SOAR, for SOAR within there, not everybody who's doing it boots on the ground. So, but we have that Springfield event on April 28th, and check out our website and see what you can do with that. But thank you guys so much. I really appreciate all the extra education that you guys always do over there. So just way to go.
Thank you, Eileen. Thank you, Olivia. And I see Olivia's put a link in the chat along with her email. So thank you so much. Appreciate that. Any additional questions before we move on? All right, Josh, you want to go to the Sangamon County Mental Health Board?
Absolutely. I'm gonna marry together a couple different initiatives here, and but I really want to make sure that you're up to date on the ballot initiative that's less than a month away in Sangamon County to create funding for mental health services in our community. As we've talked with folks over the last few weeks, we found that a lot of people in our space are just kind of hearing about this, and so we want to make sure everybody knows what's going on and has the information so that you can make a decision and advocate as you see fit. But one of the things that happened, following the murder of Sonia Massey, was that the Massey Commission was developed, and as the Massey Commission started to do their work to say, how do we create a community where something like this never happens again? One of their first recommendations was to say, we definitely should explore developing what's called a 708 board in Sangamon County. The 708 board is an opportunity that every taxing body has to create a source of funding through tax revenue, but then also state legislation sort of lays out what these boards have to look like. It's up to 9 people whose job it is to essentially
just a minute, man.
create 3-year plans for around not just what gaps exist in mental health services, but also how to fill those gaps. And then also has this funding that the job of that board is to direct that funding to fill those gaps. So as the Massey Commission made that recommendation, the Sangamon County Board put together a group of folks that they called the Sangamon County Mental Health Commission to say, we want you to study this, we want you to study what's happening in other communities, and we want you to make a recommendation back to the Sangamon County Board. I had the opportunity to serve on that commission last year and kind of walk through that process. And so I want to share a couple things that came out of that. And I doubt much or any of it will be surprising to you. And then I would just kind of want to give you a quick update on where we are and what's next. So one of the things that the commission did was put out a couple surveys. One was a survey out to community members, and then one was a survey that we and several other people sent out to you and your organizations just to get a feel for what people's experiences are with accessing mental health services, what gaps they see. And these are some of the findings from those 2 surveys. 89% of people surveyed said that they would support more county funding for mental health. 83 supported pairing mental health clinicians with law enforcement officials. This especially pertains to you all, 17% of professionals. So that means folks that work in as mental health service providers, folks that work in our space and rapid rehousing case managers and permanent supportive case managers and emergency shelter staff. Of all those who responded, 17% find services adequate to meet the needs of folks they're serving, which is, I don't want to skate past that, because I think in our work, people look at the homelessness system and expect it to fix a lot of things that are far outside of our expertise even, right? Like we need partnerships with workforce, we need partnerships with mental health and behavioral health services, right? And when those services don't exist at the scale, or they don't exist to serve the complex cases that we're working with, it makes the job harder for our shelter staff and our case managers and everybody that's working throughout the system. And this data point demonstrates that in a really significant way, right? Your work is made much.
I prefer, Josh, I prefer looking at that as 83% thinks we're not doing a good job. In fact, I kind of think we need to change that slide to see 83% the professionals say the services are inadequate. I like that bigger number.
That's a great point. That's a great point. Absolutely. And then the next one is like equally damning, right? They did go that direction on the next one. About 69% of professionals say connecting clients to care is difficult. And so one of the things that the commission asks is, does it have to be this way, right? This data is not an indication that our mental health care providers in this community are failing or they're not doing their jobs. It's a sign that, again, the way that mental health services are funded in this country is badly broken, and it has been for a long time. And that's why back in the 1960s, state legislators created this legislation that made 708 boards possible, right? To say that local communities need to have the ability and local autonomy to be able to, generate some funding for this need and to be able to direct it in the ways that they see fit. So those are a couple of the data points. Why this matters, a couple pieces on that, right? That frankly, there's a lot of people who suffer in this community because the services that they need don't exist at the scale we need them as a community. They're not accessible to them, or they don't know about them in some cases, right? We found that the greatest unmet needs were among individuals with severe mental illness. We could talk about that some more, but that's certainly a key intersection with the homelessness system of care. Justice involved individuals. One of the, being on the commission, one of the most fascinating presentations was from Superintendent Beck from our county jail. National benchmarks, for county jails our size, roughly 40% of people in county jail have severe mental health needs. Our county jail, those numbers are upwards almost 80%, 77%, right? So what that means is, as a community, our county jail is by result of brokenness in our system, right? Our county jail has become our largest mental health facility, which is costly. That's probably the most expensive way we could address this issue as taxpayers, and it's also probably the least effective way we could address this as taxpayers, right? Unhoused individuals, and then Black and African American men, rural residents, LGBTQ plus youth, veterans, and seniors, right? So again, similar in our system, when we see those places where the number of people touching our system is disproportionate to the population in the community, the data as part of this process found that to be true for mental health care as well. Here are some of the barriers that people identified: long wait times for care, cost of care or lack of insurance, transportation challenges, stigma or lack of awareness of services that exist, and then fragmented system navigation, right? It's possible, it is true, we do have a lot of great services, and are people able to navigate those in a way that's effective? People raise that as a concern. So the county board, I'm sorry, not the county board, but the Mental Health Commission explored, okay, what's possible to us? One of the ways that a lot of communities historically have funded these initiatives is through a property tax increase. That was an option available. The property tax increase would have generated about a little over $7 million a year for mental health services. But one of the trends we're seeing is that newer communities who are developing those boards, many of them are using sales tax as a way to fund these. And that's ultimately the direction that the Mental Health Commission made their recommendation. A couple key reasons for that. One is that the property tax puts the burden for these services fully on our local residents, right? As to where the sales tax, it allows a broader audience to help support this initiative, right? A lot of people from across central Illinois come to Springfield for services and utilize services here. A lot of people from across central Illinois also come here to shop. And so it's sort of recognizing that, our community is a hub for healthcare across central Illinois, but also is a hub for entertainment and shopping for a lot of folks too. And so it gives an avenue for those folks across central Illinois to help support this initiative. But the other part is that the sales tax could help us generate more funding. As we looked at the needs that exist in the community, it didn't feel like 7 million would really come close to touching it. And so if the community passed a property tax, generated that 7 million in revenue, and it only allowed for just a minimal increase in services, we expected that the community would be dissatisfied with that. And so the ultimate recommendation is a 0.5% sales tax increase. So that means on a $10 purchase, 5 cents would go to support mental health services in the community. That there are a lot of exclusions: professional services, groceries, medications, medical, all that type of stuff would be exempted from this. So the net impact of that, though, is that if this gets approved, it could generate $14.7 million annually to be used in Sangamon County, only in Sangamon County, for mental health services. This is what it'll look like on the ballot. So March 17th is our next, or is when this will be on the ballot. A couple things to note about that. That's a primary election. We've talked to people who say, well, I don't really identify as a Republican or Democrat, and so I typically skip the primaries. You can request a referendum only ballot and vote, just on this. The other thing that I would mention is that early voting has already started. March 17th falls on District 186 spring break. So if that poses problems for you, the Sangamon County Clerk's Office is already has posted hours for when you could go in and vote for this if you'd like to. Expected outcomes, again, we were able to look at different mental health boards across the state and some of what they're seeing. Again, our service providers could benefit from more support, right, to grow the services that they know our communities need. That would lead to better access to care. If we're meeting these needs, hopefully in more of a preventative space as opposed to ER, but also, communities across the state are developing what's called a certified community behavioral health center, or are moving towards that model, which really emphasizes, 24/7 crisis care, not through the emergency room generally. That model also requires communities have things like assertive community treatment teams. Our community had an assertive community treatment team, which essentially pairs licensed clinical social workers and mental health professionals and even psychiatrists in sort of this mobile unit that goes to where people are and kind of takes full responsibility for people with severe mental illness all the way from housing through healthcare. Our community had that over 10 years ago, but as grant funding went away, so did that program. And I think we've seen that in a lot of spaces, right? We've had some great programs over times, but we haven't been able to sustain them because federal and state funding ebbs and flows. And so something like this would give us the opportunity to really emphasize those services that we need and create sustainability beyond federal and state funding. The other, just a bold note there, I think with the commission put a lot of work into, how does this benefit our community? I certainly within our work, we can easily see how having access to better services and more intensive services at times would better serve the folks we're trying to work with. But the other reality, and we see this in housing too, right? If we don't create adequate permanent supportive housing opportunities and rapid rehousing opportunities, we have to keep building bigger shelters, and we have to keep hiring more street outreach workers, which are all, we lean on all of these costly interventions instead of solving the problem, right? And so that's kind of an emphasis here, is if we can do everything we can to, again, address the crisis issues that exist in our community, but also work in the preventative space, right? Funding the programs that our schools have had, that begin to help our children access mental health care from an early age, right? Doing those types of things will have impacts later on too. And there have been studies that have said when we invest money in this way, it ultimately saves the community money, right? Connecting a person with housing and mental health services instead of putting them in the county jail is less expensive for our community, right? So that is a one point that I think it's important to emphasize.
Josh,
So-
Ramona was asking the question if you have data to back up a lot of those statistics, or where do those numbers and things come from?
Yeah, so all of the data shared was through the survey. So we will, in the email we send out following up to this, we'll send an email to the counties. The commission produced a report. It's over 100 pages long, but don't let that scare you. I think the first 16 pages are where the content is. But that report has, here's how we did the studies, here's what the studies found, here's the zip codes that people responded. All of that is in that report. So the data that comes out of that, and this presentation is all in that report that the Mental Health Commission put out.
She was asking about measurable outcomes specifically.
Yeah. So I think in terms of measurable outcomes, I think that's one of the interesting things about this, right? Is that if the community says, yes, this is important, we are passing this in March, the next step is that the county board will have to assemble a mental health board. They'll have to put that body together, and then that body will be the one that makes decisions, right? So nothing done in the mental health commission report, through that body forces the mental health board to do anything. They're mandated by state legislation to do certain things in terms of a needs assessment and a 1-year plan and a 3-year plan. So all of that would be a part of that process. The mental health board getting created, assessing community need, putting out requests for proposals, and those requests for proposals would certainly, I would expect, have measurable outcomes. So.
Well, and I think, and I don't think you mentioned this, but you might mention how long some of these 708 boards have been around that have seen measurable outcomes, and how long some of them have been in existence since the 60s, correct?
Some have been around
the
from the
ones that you
60s.
studied.
Yeah, I think the one that we found that was most exciting to us that we spent time with was Winnebago County. And then we can put that link in the email we sent out to you. That's a relatively new mental health board. It covers Rockford. It covers a similar area to Sangamon County. I think there's a lot of comparable components to that. And they also use a sales tax to fund theirs. And so a lot of the things that, they keep a dashboard of, here's the organizations we fund, here's what they said they would do, here's the results. All of that is on their website in a way that I think we absolutely should mimic and encourage the mental health board to adopt if it gets approved here. But they're also measuring things like, okay, we put together some of these initiatives, and the whole design of this was to get people connected directly to mental health care instead of showing up at the emergency room. So in the time that we've been funding this, what has changed, right? And so they're seeing like a 60% reduction in emergency room visits for these needs because those folks are getting directly to the crisis center. So there are things like that I think Winnebago County has done a wonderful job modeling for a community like ours. If we move forward, that we absolutely should we absolutely should do everything we can to mimic. And a lot of that is in the Mental Health Commission's report too. You'll see some of that reference there as well.
Thank you. Any other questions? All right, thank you so much. And that day is March 17th, am I right?
Correct.
Yes. Okay. All right, you want to go on to HUD update?
Yeah, so when we go ahead and skip ahead, Jamie, to catch us up on the presentation. Oh, I haven't. We don't have a slide for this, so I'm just going to catch us up here real fast. But when we met in November, one of the things that we shared with you was that HUD had just released a NOFO. That NOFO, if enacted, the result of it would be to drastically change how the federal government funds homelessness services, with a dramatic shift away from permanent housing towards transitional housing and street outreach and things like that. In the time since we've met last, there were lawsuits against the federal government that caused HUD to ultimately pull that NOFO back. And then earlier this month, the THUD committee passed recommended, and it ultimately got passed by Congress, a appropriations bill that said that HUD had to automatically renew the grants that they were trying to not renew through that November NOFO. So the significance for our community, one is that our funded organizations, it's roughly about $600,000 that comes in the community from HUD. Their grants will be renewed into 2027. So that's good news. The other part of it is that the action of Congress said that HUD, if they're going to release a new NOFO, which they will, it has to be done by June of this year. So we'll see what changes that's going to lead to by June. And then they said that the next round of awards have to be announced by December. So wanted to update you on that because we did provide that at a time in November, the sky was falling type of presentation. So there's been a tremendous amount of advocacy around that. I think it's good news. There is also ongoing legal action against HUD in regards to that previous NOFO, which depending on how that goes, it could determine how the new NOFO looks. So there's still a lot of things in development. As that NOFO comes out, we'll certainly be sharing that with you all and talking about it too. One of the things that we're thinking a lot about, and part of the reason, not just around SNAP, but really the emphasis on helping people increase their income and get access to all the benefits they're eligible for. That in that November NOFO was a really significant part of the competition, more so than in the past. And so HUD is kind of signaling, and rightfully so, as people are in our programs, we need to do everything in our power to lean on those partners and get help to get people access to benefits and increase their income. But again, that historically is a space where our data does not look great as a continuum. So I don't know if that means that when we do our annual reviews of clients, maybe we're not at that, or it could be that we're just struggling. And so that's a key focus for all of our service providers right now, is doing everything we can to get more support to improve that. So wanted to update you there. So good news. We'll keep you posted on what happens next, though.
Right, before we go on to the agency updates, you want to do the needs assessment?
Go for it.
Yeah. We just have created a brief Google document or Google form, I'm sorry, that we are urging people to fill out for 2026, kind of our needs assessment. We have questions on there that ask about different barriers or unmet needs in our community, talking about if there's any challenges or repeated challenges that agencies are facing, and just really we want to understand and get a lay of the land of all of that across all of our agencies that we are supporting. That way we can be intentional moving forward with policy reviews or resources we bring to attention, or whatever we can do to support. So we will include that link, the Google form link, also with the links that we send out after this meeting. But really encourage folks to fill that out for us.
Yeah, connected to that, we've been working with Home Base over the last 6 months or so to do a check-in on our strategic plan implementation, like where we're doing well, where we need to focus on. They're going to make a presentation to our strategy board in early March, and then in April we'll be bringing that to you all as a presentation as well. So all of that is connected, right? We want to look at the analysis from the outside consultants. We want to look at what our local partners are saying as we kind of chart these next steps in terms of how we implement the plan, and how we try to strengthen some of these areas where we're weaker as a community. So please take a few minutes. It's nothing intense. Please take a few minutes to fill that out.
Thank you. All right, any agency or updates? I know you're doing something out there. Come on.
Now I share a little bit about
Bonnie.
how we've grown our case manager base at Helping Hands. I might leave out something, being that I'm not the person probably to present it, but I'm excited about it, being a member of the team here for so long. We have 2 case managers now that are dedicated to rapid rehousing, 2 dedicated case managers for home ARP rapid rehousing, which is like a hybrid, and 4 dedicated case managers for our permanent supportive housing program. And all that's allowing us to just boost numbers of clients being brought into housing right now. So that's all very exciting. I always say getting new clients for me is like Christmas, getting to tell someone, hey, we get to house you here really soon. I think beyond that, I think we've increased our number of case managers here within the shelter as well. And I'm sure that is making its mark too.
Well, we will celebrate with you, Bonnie. Thank you so much. Anyone else?
Good morning. It's Matt from Gateway Foundation. I wanted to share a new service that Gateway is expanding into. Is right now we have started virtual mental health services that is available right now to only patients with Medicaid funding. So if you have a person needing to get established, perhaps they can't make it in person for, in-person counseling with a different provider, we do have services available for all the MCOs, anything like that. I can be a direct contact for that, but I at least wanted to make that update here today. So thank you.
Thank you, Matt.
I'd like to share a couple of items.
Sure,
Sure.
Ashley.
So one, the Veterans Assistance Commission will be posting a position for assistant superintendent. If you, I don't have a date just yet. I'm hoping tomorrow. But if you guys have anybody that is an honorably discharged veteran, just kind of keep them in mind. Please share that once that's out. We will have that posted on our Facebook page, also on the county's website, and we'll have the applications in our office too. So I want to get that out there as much as possible. And then I don't know if everyone is aware, but a huge part of what we do here in the office is file VA disability claims. So similar to Social Security, but specific to VA. So we're intimately familiar with that process. So I recently started kind of looking at stats for our financial assistance veterans, because I noticed that historically that data has not been collected as far as we've just had kind of that repetitive veterans seeking financial assistance, and we're not doing anything else to try to increase their benefits or just their financial situation. And I just say we collectively, I've only been here in the position for 2 years, but so just we look back at last year specifically, and we had 88 applicants for financial assistance. Of those 88 that were approved, 18 had decided that they wanted to file claims. So that's around 20%. And they had been approved. I apologize, I didn't pull that up. So I'm kind of pulling it from memory. But that was around like $263,000 for the year in benefits that they were awarded tax-free. They may be eligible for property tax exemptions and other discounts or benefits and healthcare, all that stuff. So we continue to be very intentional about applying for VA benefits and healthcare, not just for the veteran, but for their families as well, and trying to take a deeper dive into what benefits they qualify for, and looking at the totality of their situation. So I just wanted to bring up that point, because I know Josh was talking about that, but specific to veterans, it is something that we are taking a deeper dive into. So if anybody has any, comments, questions, feedback, input, please let me know. I'm always open to seeing how we can adjust our process to better serve our veterans. So thank you.
Thank you. Thank you, Ashley. Leanna said she can't talk right now, but MBH does not have a wait list for therapy, for youth services, PATH, or adult case management. They also updated their website and have a referral form you can fill out online. And then she included the link also in the chat.
Hey Val, this is Juanetta. I also wanted to make an announcement that Heartland House and Washington Street Mission will be partnering on Monday, March 16th. We will be having a recovery fair that will cover everything addiction services. It will be a lot of partners there. So if anybody has clients that are struggling with addiction or just want information, it will cover everything from treatment to medical assisted treatment to physicians to resources for people who are active in struggling with alcohol or addiction.
Is that at Washington Street Mission? Is
Yeah.
that where it will be?
Yeah,
Okay.
and we have sent out the flyer. If anybody is still interested, please let us know and we can get it to you.
And the hours?
It will be from 8:30 to 10:30. No, I'm sorry, 9 to 10:30. People
Okay.
that have a table will get there at 8:30 to sign up and set their tables up.
Okay. Okay. All right. Thanks, Renetta.
Thank you.
I just
Anyone
have a real
else?
quick update for Salvation Army, and it's for any clients or community members who are struggling with food insecurity. We are actually offering a supplemental food distribution and a hot meal every Wednesday night from 5 to 7 here at the core. There's no documentation or verification required. You just come in, tell us how many people are in your household, then you're free to choose from the food we have available and sit down and have a hot meal. And you can come every week from 5 to 7 on Wednesday.
All right. Thank you, Dee. Anyone else? Any public comments? I don't know if she's still on here, but I kind of would like to give a kudos to Jane Ford, who is really, really helping out with publicizing the 708 board, the mental health board initiative. She's sending something out, gosh, every day, every other day, and trying to give as much information. And we appreciate that.
Thank you, Jane.
All right. If there's nothing else, Josh, anything from your team? Anybody else have anything? Nick, anybody?
I don't think so. We, in the general membership emails, we have been sending out, the state of Illinois is doing a couple listening sessions today. One starts in 3 minutes in person. But for folks with lived experience, there's one later this afternoon. So just want to direct people to that if they're able or interested.
Good. Well, and you should get a recap of everything we've discussed, everything that's been in the chat. Molly, thank you so much for keeping us all straight and in order. So we appreciate that too. All
Thank you,
right,
Val.
may I have, our next meeting will be April the 16th at 9 a.m. May I have a motion to adjourn? Or we
I'll
can
make
stay
the
on.
motion.
Thanks, Amy. We'll see everyone on April 16th. Thank you so much and keep doing what you're doing.
Bye, everyone. Thank you.
Bye.
Thanks, Val.
Uh-huh.
Or am I missing it?